Good morning. I'm Tom Butcher of the Zero Project here in Vienna at our conference. I am online, sadly virtually, with Charles Yassin, all the way from Malawi, where Charles is actually with World Vision Malawi. I understand, Charles, that World Vision has developed a groundbreaking disability case management app. So, to kick off, could you please tell us a little bit about the app and how, as a case management tool, it differs from any others that might be out there?
All right, thank you very much. Yes, we have the CompCare case management application, which we're using under the Able to Thrive project, which is targeting 17,000 children with disabilities. So for the CompCare case management application, we are primarily using it with caseworkers who are directly in the communities. And we've noticed that this saves us a lot of costs because for the greater part of the time, if we were to do case management using different specialists, it requires more costs to be able to have the specialist monitor each and every child individually. And secondly, when we're using the caseworkers directly in the community, we're getting real-time information regarding the different changes that are happening in the children's lives. So the case management is much more effective because we're able to get that data, and in fact, we're able to share this information with our specialists. So instead of having all specialists coming together and do a screening exercise, we're able to give them the detailed information regarding the children that they're going to meet. And this also helps in ensuring that as the specialists are visiting, they're bringing the necessary equipment, the necessary assistive devices and technologies which will be required and will be used. Because you may agree with me that it would be very unfortunate to invite specialists who will come to the screening site but do not have the necessary equipment to provide the necessary support to the children. So in order to avoid that gap, this application is there to give us that information, which is very necessary to ensure that service provision is maximized using minimal resources. Thank you very much.
And those resources are used most efficiently, I presume.
Yes, definitely.
Great. My second question is, and this is probably quite an interesting one for you, which is, what are the challenges that you've either encountered or that you've had to anticipate, both in developing the tool and whilst the tool is actually being used? So before the tool was developed, during development, and
when it comes to implementation of this. But now it brings us a platform where different stakeholders can engage in and to ensure that a child is provided with the holistic support that is there. Secondly, when we're looking at case management prior to this, that means we would have to use the paper-based type of documentation. And there was a lot of issues to do with privacy, a lot of issues to do with how losing this documentation, because if it's paper-based, then maybe it cannot be stored in a necessary manner, and this poses a lot of challenges. But now, since it is system-based, this information can be accessed remotely. Even right where you are right now, you can be able to access this information and be able to understand the different issues or the different challenges that are being reported and how these are being overcome. So this was what it used to be like, and as I've already stated, that in the past, we would have to bring specialists and go about the entire community so that we start the assessment. But now with this case management tool, we're able to identify those requiring the necessary support and the kind of support that is required, so that even as we're working with the specialists, we give them the comprehensive information regarding the children with disabilities that to meet and the necessary support that is to be provided to them. So when it comes to the anticipated challenges or challenges encountered, we're looking at this being a case management tool, and possibly it's not an issue that people would normally understand. If I were to say case management, others would still look at it as data collection. But this is case management, and it requires continuous follow-up, monitoring, so that we're able to track the changes that are happening. And this also helps in informing the program on how best we can develop some new strategies to ensure that we're providing the registered recommendations. And another thing is to do with, as we're working with different partners, Other partners may have their own case management tools. Other partners will have their own data collection tools. So it may bring about a challenge where others may feel like we're duplicating work. But as we're moving forward, there is a lot of collaboration that is in place to ensure that all these different data collection or case management tools are brought together to ensure that we have one comprehensive tool that will be able to fit into the needs of different partners and different practitioners. Thank you very much.
Great, thanks so much. I'm going to come on to some more detailed questions after my last question. And this is my last kind of general question about the app. So is the app adaptable for partners both in different geographic and economic contexts?
Right. Yes, the application is quite adaptable, and not only on geographical settings, but also it's accessible when it comes to disability inclusion because it has the talkback features, which can be used for anybody that requires that kind of support. And looking at the geographical settings, I'm thinking of issues of language barriers and whatnot. All these have been taken into consideration to ensure that this provides the optimal support for a particular stakeholder, for a particular implementer, so that it is we do not have any challenges in terms of the coverage or the use of this application. So to answer your question, yes, it is very quite adaptable. Thank you.
Great. Okay, so let's talk about your use of it in Malawi and to put things into context for our viewers and our listeners. Have you implemented it throughout the country, or is it just being used currently in specific regions?
So at the moment, we are working in 10 out of 28 districts.
Right.
So that gives us an average of 35% or so. So we've been able to use this application for the past 3 years, and the results are quite immaculate. Thank you.
Right. And did you roll it out in a single region first, or did you say, okay, I'm going to choose 2 or 3 and then try it all at the same time in those 3 regions?
So we started off with 5 districts. Of course, these 5 districts are primarily in the northern and central region.
Yeah.
But now we're expanding to the southern region as well so that we can be able to reach out to more children. Because like I stated, we're targeting 17,000 children and 20,000 caregivers. So this application was not segregated to a particular type of geographic location, but when it was introduced, we rolled it out to all 5 districts and now extending to the other 5 districts.
Right. And you say 20,000 children. Does that translate into 20,000 cases or 10,000, 8,000 cases that are being managed?
Right. So the 20,000, those are caregivers. Of course, for the children, it's 17,000.
Yeah.
So yes, these are 17,000 cases for each child to be managed. So as I say that, we're working with the community stakeholders who have proven to be a very important resource because for specialists only to manage 17,000 cases, it would be very difficult. But now by working with the community stakeholders who can be able to monitor an average of 30 children, then it becomes more manageable. Now it gives us the best results because there's no issues of fatigue or lack of resources or lack of equipment to monitor these children because they're quite manageable, unlike having the whole 17,000 being managed by quite a few or limited number of specialists.
Right. So it's really incredibly helpful because it introduces manageability.
Yes, definitely.
Great. I think I've probably got time for 2 more specific questions. The next one is, you mentioned stakeholders. It'd be really useful for listeners and viewers to understand who the different stakeholders are.
All right, thank you very much. First of all, we're working with the Ministry of Gender, Disability and Social Welfare, which is under the Malawi government. And we're also working with the Malawi Council for Disability Affairs, which is the primary stakeholder when it comes to disability issues here in Malawi. And besides this, we're also working with different service providers, such as ABC Hearing Clinic, Hope and Healing International, and Lions, and also BQ who are also providing us with the necessary support, because whenever we identify the children, we are supposed to refer these children to receive the required services. So these are the partners that we've also been working with for the past couple of years. Thank you.
Great, thanks so much. And one last technical question is, the actual data, do you have a single server upon which the data is kept, or are the data kept locally?
Okay, yes, we have a single server where we're keeping all the data. And for data analysis, we also linked it to Power BI so that it can be able to give us the trends and understand how things are working out in different communities, different districts, and with disaggregation on gender, disability, and whatnot. So we have a single server, but we're also linking it with the Power BI for data analysis.
Great, thank you so much. Which other countries would you like to take it to?
Possibly Rwanda,
Yeah.
and or other countries across the globe, because this is a game changer, I believe,
Yeah.
and I would really want it that different partners we can collaborate and ensure that we're working together on this application,
Yeah.
so that we can reach out to more children with disabilities, not just in Malawi, not just in Africa, but across the globe.
Great, what a great ambition, and keep that ambition up,
Yeah.
keep it global. Charles,
Thank you very much.
That's my pleasure.
Yeah.
Before I sign off, with everybody with whom I do my fireside chats or interviews, I'd love you to leave me and listeners and viewers with a single call to action that they can take away from our discussion. What would that be?
All right.
And you've got 2 minutes, 49 seconds.
All right, all right. Okay, so I believe that for the greater part of the time, people will talk of disability programming as being very expensive and being very involving. But I believe that this all goes down to the tools that we're using and how best you're collaborating with different partners. So I would say that in disability programming, we are all partners, and it is very important that we work collaboratively to ensure that all children with disabilities, all people with disabilities are supported. And it shouldn't be like an individual or an organizational effort, but all of us, we should hold hands together. And
Great. Charles, thank you very much indeed. I'm going to sign off in a couple of seconds. I want to say thank you very much.
I think that's a...
Yeah, thank you very much to you. Thank you very much indeed to World Vision Malawi. I think you're doing absolutely wonderful work. I wish you all the very, very best going forward, and not only spreading the word, but spreading the work and learning next year, if not sooner, that you are in surrounding countries and that everybody is using your tool. Look after yourself. I don't know what time it is with you in Malawi at the moment. What are you? What is it?
Yeah, this is 10:53 a.m.
Okay, have a really good rest of day, and thanks once again for being with us on our Fireside Chat today. Bye.
Thank you very much. Bye-bye.
Thank you very much indeed, viewers, listeners, and people in front of me. Thanks, Charles. Thank you very much.